An interesting experiment has been done, which I briefly describe in the booklet. It is to do with metastasis. Personally, I do not feel comfortable with the use of live animals for such experimentation, but it does show a useful result. The experiment was using mice and 2 samples of cancer cells. The cells were marked so that you could tell which cells were from one sample and which were from the other sample. The samples were inserted into a mouse into different locations under the skin. The cells were then monitored. Now, some of the cells from site A travelled to and lodged at site B, and vice versa. And this was before they metastased to any other sites or organs. And so this is a very interesting result, because it means that the cancer cells are in circulation in the blood system long before they attach themselves to any organ, and it is the attachment to an organ which actually does the damage. So, if there is indeed the potential to tackle the cells as they are in transit, then we have a very powerful tool here to tackle the cancer spread. So, how does cancer spread in the body? There are 4 main mechanisms. It can transfer via the lymphatic system. This system is a one-way flow of fluids within the body, and finally draining into the blood system. Many of the smallest lymphatic vessels are close to the skin surface, so if the pulsed light is shone through the skin, it can reach into the lymphatic system to an extent. It should be noted that the lymphatic system has a one-way flow of fluid. It is not a circulatory flow like the blood system. The most common way in which the cancer spreads around the body is via the blood system. So to get from the tumour in one organ at the primary site, the cells that break away from the tumour are pumped around the blood system before finally lodging at the secondary site. An important understanding is the realization that the blood flow is a parallel system with organs connected like the rungs of a ladder. So every organ is in parallel with every other organ. For example, for the blood to go from, say, the liver to the brain, the blood has to flow firstly to one half of the heart, then via the lungs to the other half of the heart, before a proportion of the blood travels to the brain. In other words, cancer cells are not transported to the blood directly from organ A to organ B. Quite often the spread of cancer of a particular type is associated with the spread to particular organs. So, for example, there can be breast cancer cells growing preferentially in the bones. It is still classified as breast cancer, but the important point is that the cells from the breast tumour will have transited through all of the organs in parallel before selectively lodging in the secondary organs. In other words, the breast cancer cells will be also circulating in the skin, but not lodging there. So, if we can use the light-enhanced chemotherapy to attack the cancer cells in circulation, that offers a great opportunity to prevent their lodging elsewhere. I should point out that this is my own theory. It is not yet mainstream medical theory. I am, of course, working on trying to get mainstream medical people interested in this new concept. Briefly, there are 2 other ways in which cancer cells can be transferred from one organ to another. One is via the contaminated medical instruments such as scalpels, and the other, less common way, is that the cancer can spread from the surface of an organ and move via the connective tissue to another organ. I have described how the use of light-enhanced chemotherapy could reduce the spread of cancer from one organ to another. Although this could buy some time for the patient, in itself it would not assist with shrinking the tumours at the existing sites, particularly those tumours which are too deep within the body for the light to penetrate. It would be a useful holding strategy, but not an overall cure. Nevertheless, for many patients, that in itself would be worthwhile, to give an extended life and better quality of life. So my third strand of thought is, how can we do something to shrink the existing tumours, both at the primary sites and at the secondary sites?